preconception health is very important. So now when a patient comes to me, say married for a year, young couple, they come married for a year. What I always tell them ki, okay, if you're smoking, stop smoking. Because at least we need 3 months for the harmful effects of that cigarette or alcohol, or God forbid if they're using drugs or anything like that, वो हमको system से निकालने के लिए 3 months लगते हैं, because your sperms take about 3 months to produce a new batch. So when you're looking about males, it takes almost 71 days for the fresh batch of sperms to get created. So if you start smoking today, the sperm which is not affected is going to come 71 days later. Same thing with alcohol, same thing with the woman. Women का हर महीना एक अंडा release होता है, पर वो एक अंडा has been selected 3 months ago by your body. So again, all these effects take approximately 3 months to take place. Then secondly, obesity. जब हम लोग obesity के लिए देखते हैं, the chances of fertility are slightly lower. In addition to that, we also see कि miscarriage rates ज़्यादा बढ़ते हैं. अगर diabetes है, तो फिर हम लोग वो diabetes को control में लाना चाहते हैं, because diabetes can cause a lot of problems in the baby in terms of chromosome abnormalities or structural abnormalities. Blood pressure also, we want to make sure that the patient's blood pressure is within the normal limits. So definitely we are always trying for all of this. Anemia, most ignored topic in India. In fact, in our population, almost 58% are anemic. 58% in all of India. So I don't even want to get into the numbers. It goes into the billions. So when we look at all of these things, we are trying to get all these parameters into the normal limit or near normal limit, so that the baby has a healthy, smooth journey and a healthy delivery. And more importantly, the mother also has a healthy pregnancy and a safe delivery. See, we are not only looking at the baby, we have to look at the mother as well.
Absolutely. But when you're talking about, like, just आपने smoking की बात करी, right? It's an established fact now that not only it affects the fertility, the sperm count, the smoking, but also the quality of the sperm.
Absolutely.
Right? It interferes with the DNA structure.
Yes.
Right?
So there
it changes the chromosomal.
So it doesn't change, but it damages
it. Damages. That's what I mean.
It damages
exactly.
it. Because what happens is when you're smoking, there are these super oxygen radicals which get formed. Chemistry में O3 करके रहता था. So that also gets produced in your body, which attacks the DNA. And that damages the DNA in the sperms, and then the chance of fertilization reduce. Or agar fertilization hota hai, तो there's a risk of abnormality. So these are issues.
This is the impact.
Yes. In fact,
scary.
In fact, there was a research paper. I was actually giving a talk on this. There was a research paper which showed in 2020, the sperm count has dropped down by 50% from the 1950s.
Oh my God.
It's still within the normal range. I'm not saying that it's dropped down to the point ki it's abnormal, but it's gone down from 100 million, what the sperm count used to be in the 1950s, to 50 million now. So we don't want that in another 50 years, 50 million se wo 25 million ho jaye.
You know, doctor, when you're saying this, the thought which is crossing my mind, I'm like, एक smoker को हम लोग उसकी तबीयत पे भी लिख देते हैं, is injurious to health, causes cancer. And we are harping so much on that, right? Cancer is killing only that one person, and probably the economic structure or the emotional thing of the family. But imagine smoking से जो आपके sperms impact हो रहे हैं, उससे तो अब अगली पूरी नस्ल को खराब कर रहे हैं. It's a whole generation.
I think that's a very good way that you've put it.
So instead of writing that this causes cancer, it should be, it is ruining the next generation because of the quality of the sperm, which is getting damaged.
Absolutely. So
I hope the government hears this. And please write it on the boxes. This is more dangerous than just having cancer, if you ask me.
So there's also a new concept called third-hand smoke. Okay.
The passive smoker?
No, that is second-hand smoke. I read this new concept called third-hand smoke. So second-hand smoke is ki agar if I'm smoking right now and you're just standing next to me and you're inhaling the smoke, that's second-hand smoke.
Right.
And we always tell pregnant women that don't be around smokers. So the husbands who do smoke, they don't smoke in the house. They don't this. They will step out to have a cigarette or something like that. But they say that when you're smoking, the particles fall on your clothes and everything. And that can also have a detrimental effect on your partner if she's pregnant, or say you have a newborn or anything. what you do is, say you've just gone out for a cigarette and you come back and your babies and you hold the baby. This. So they say that if you're a smoker, once you come home, go take a shower, change your clothes, and then go next to your partner and things like that. So it's not just like this. It has a wide variety and range, and cigarettes are bad. Let's just get down to it.
They're not just bad, they're killers. They
Exactly.
are true killers, actually, right?
True.
So I hope all you supportive partners, male, female, please, please, please इस point को consider करिए. Before getting pregnant, the preconception health, quit smoking, which is bad in any case. But when you see these dangers, I think, then this is a very responsible thing for a parent to understand.
Absolutely.
Do they want a child that has been given abnormality because of their certain habits?